The chair recognizes the gentleman from Connecticut, Mr. Courtney, for 5 minutes.
Thank you, Madam Speaker. Madam Speaker, after an extraordinary lengthy recess that Speaker Johnson ordered at the third week of July, Congress is finally back in session with a huge to-do list. If there was any benefit in terms of having members back home, though, it was an opportunity to go out and listen to what's on people's minds. Town hall meetings, community gatherings, offer, again, members of Congress a chance to listen to people in terms of what they care about the most. And I had a number of those events in Mansfield, Connecticut, Colchester, Connecticut, Old Saybrook, Connecticut, with very packed rooms. And the issue that was of most concern was H.R. 1, what President Trump calls the one big, beautiful bill. While we were away, the Congressional Budget Office had a chance to finally zero in on final numbers in terms of the impact of H.R. 1, the one big, beautiful bill. Again, it was being written over and over again and changing up until the final minutes, but they finally got some clarity. And what they determined was that the number of people who will lose their health insurance coverage because of H.R. 1 is 10 million. 7.5 million of people on Medicaid and another 2 million people who get their insurance through private health plans on the exchange. They also calculated the debt impact in terms of H.R. 1 because of the massive giveaway to billionaires in the top 1% of this country. And they determined that, again, the bill is going to add $3.4 trillion to America's deficits between 2025 and 2023. The debt service on that additional debt is an additional $718 billion. That's just pure interest, has no value in terms of services or programs that actually help the American people. Because of that debt figure, the bill triggered another law called PAYGO, the Pay-As-You-Go law, which was passed in the 1990s, to put pressure on Congress not to pass legislation with that big of a deficit impact. Unfortunately, the majority ignored the PAYGO rule, and what CBO told us on August 15th is that will trigger automatic cuts to other programs. That's the way the PAYGO law was designed, to again create some deterrent on Congress from excessive deficit spending. And the Medicare program, the program that helps people over age 65, is the one that's going to take the hit, a 4% across the board, $45 billion PAYGO cut because of this measure. Now, in addition to those numbers, what we're also hearing about is from the groups that are going to be impacted. Madam Speaker, in this morning's Connecticut Press, there's a story, What Worries Connecticut Hospital Leaders, about Trump's big, beautiful bill, which I would ask to be admitted to the record. Thank you, Madam Speaker. And again, this article went out and interviewed hospitals across the state, urban, rural, suburban. And what all of them are reporting is that the hit of $1 trillion of Medicaid is going to ripple through the system and cause impact for everybody who, again, relies on those critical services. Dan Keenan from Trinity Health Services, St. Francis Hospital in Hartford is one of their big members. I was born there a number of years ago, stated, the impact goes far beyond those who lose coverage. Our entire health system and every community we serve will feel the effects. Reduced services, longer wait lines, staff reductions, and potential closures of programs and facilities. He pointed to emergency rooms as an example. When people don't have coverage, they turn to emergency rooms for basic care, resulting in crowding, service delays, and staffing issues that will impact the entire system. That affects everyone, and it will spill over into people's employer-based commercial insurance premiums, which again, the article goes through in great detail. Madam Speaker, President Trump the other day said he actually doesn't think he wants to call the bill the one big beautiful bill anymore because, as he said, it was good for getting it approved, but it's not really good for explaining to people because people have figured out enough in terms of deficit impact, taking away people's health insurance coverage, and the impact on services, particularly in the hospital sector, which they warned us about before the bill was passed, and yet the majority in the White House turned a deaf ear. We have a lot of work to do when we get back into town starting tonight. And again, one of them would be nice is if all the members who had town halls, and I know Republicans heard about this as well as Democrats, that we recognize that this bill is not the 10 Commandments. We have the ability, we have the legal authority to make changes and listen to the people who are warning us that it is actually going to harm the American people, and there is nothing beautiful about it. I yield back.